Hi, everyone. This is Adam with Adolescent Health Working Group. Thanks for joining us in today's conversation. I am AHWG's Executive Director, and I'm here with Justin.
Hello, I'm Justin, and I'm Communications Director at Adolescent Health Working Group. And AHWG is a coalition of youth caregivers and youth serving providers. We seek to increase the capacity of providers and promote equity and access to healthcare. And you can check out our website at ahwg.org for more information on trainings and free resources.
So Justin and I are going to have these regular conversations about things related to young people, health, and we want to focus on topics not only around the country, but also highlight what's happening in local communities. And we're having these conversations as an opportunity to highlight new strategies, new approaches to equity and access when it comes to young people and health. We think this is an opportunity to promote what people are doing that are innovative, and we hope that you'll join us in future conversations. Today, we really want to focus on something that might be on a lot of people's minds, and we're in the midst of summer, but a lot of folks are planning, families and providers, what's going to happen with school in the fall. Adolescent Health Working Group over the past several months has been focused on distance learning and homeschooling, particularly with young people in middle school all the way up through college. And so Justin and I are going to jump into this conversation a little bit today. I think the first article we want to highlight was just, I think, exactly a week ago. I'm referencing the New York Times here, and this is a call by the American Academy of Pediatrics recommending that children return to in-person schooling. Have you seen this article, Justin?
I have. And yeah, so it sounds like children should just return to schooling and we have solved it and it is no longer complicated, right?
Yeah, it's interesting. I think it triggered a lot of gut reaction in different folks, especially in states and counties where social distancing is a huge priority for the community. Um, the recommendation was it was personally a surprise, and I have a kindergartner enrolled and supposed to start school public school for the first time this fall. I do have reservations about sending her back to school. We live here in the Bay Area, and some of the recommendations, there are obviously like guidelines on how to practice health and safety from AAP. But one of the things that I think sparked some conflict was even distancing in students' desks. I think we've all heard the magic number of 6 feet by now, 6 feet apart. And the guideline from AAP is 3 to 6 feet. So it leaves some room for debate there. And how would you feel if like suddenly grocery stores or Costco even was like, hey, by the way, next week, Monday, we're gonna stop distancing 6 feet and we're just gonna put it at arm's length.
Well, I'm already having some anxiety and stress when people at grocery stores are not staying 6 feet and are standing at arm's length apart. So I'm probably not the best person to ask about that. It is challenging when looking at the AAP recommendations and many of the recommendations that are going to be coming out because each of them is addressing the constituency that they're serving. So for any organization that is or agency that is kind of solely focused on the economy, they're going to advocate for schools opening up every day. And for a lot of parents, they want schools to open up because of the toll that it's taking on their home life and kind of work and finances. But school districts and teachers unions are going to have different recommendations because they also have to weigh the health of the educators and all the folks who work at the school. And they also have the knowledge base of what is or is not realistic or feasible in a classroom setting. I think the AAP recommendation, they seem to be kind of they have a primary focus on the children and adolescent youth and are weighing in that kind of being physically present at school reduces some of the health and social and educational risks to keeping children at home. but these recommendations don't factor in as much of the sort of broader questions about the health of everyone in the schools that other organizations might.
And I think like one of the big premise for the Academy of Pediatrics recommending students return, which so this is a piece I do agree with, is like home isn't always the safest place for young people, unfortunately, right? It's a sad truth to recognize. Not only that, that there are a lot of benefits, obviously, to socializing, getting kids outside of the home to interact with one another, engage in like extracurriculars beyond school, right? Just an art activity, a physical activity even. So yes, there are benefits to that, and apparently this is what AAP is suggesting, that if we were to kind of set the scales of pros and cons to returning, that there are much more benefits to returning. Now, but here's the thing that is an issue for me. It's like, um, it's they went so far to say like we're observing states across the country, and what we're seeing is that numbers of young people contracting COVID-19 is significantly younger than adult or elderly population. And they said they're going to continue to monitor and track this. And so again, this recommendation came out about like 7 days ago, a week ago. And 4 days ago, Oregon then releases a new fact, a new statistic, which is in in the past month, in June of 2020, the figure and rate of children under 10 years old has gone up times five. And now this can be due to like increased testing, but again, like researchers are actually attributing this to community spread. So it really has to do with the fact that in June 2020, a lot of states have begun reopening for business, um, restaurants, beaches, et cetera, et cetera. So if we're actually seeing that community spread can happen, that it can happen given that we've already had daycares open for a significant period of time, and daycares in some states have not even closed at all since March 2020, that maybe I'm surprised. I'm surprised that AAP is saying like the rates aren't impacting young people.
It is surprising, especially as we're in a period of time and we're recording this in early July, that we're still learning more about the disease, and our knowledge base is kind of constantly changing. I've read kind of some interviews and reports that point to data from other countries that show that teachers who got COVID-19 were more likely to receive it from other teachers or folks at their school than they were from children in the classroom. But the fact that they still received COVID-19 is an issue, because at this point, everyone is kind of needing to do a risk assessment when they make their decisions about where they go and what they do. And when schools open back up, there's going to be more risk, not just for teachers, but for everyone who works on a school campus. So administrators and custodial staff and counselors, secretaries, nurses, registrars, kind of all of these folks need to take into school districts need to take into consideration all of their health, and school employees getting COVID-19 will also affect young people. I saw an interview with a school administrator who was the school administrator is based in New York, and they were discussing that the hardest emotional moment for them was actually having to tell third graders at their school that their teacher had passed away from COVID-19. And the difficulty is that even as there are reasons that opening up schools are hopeful and healthy for some individuals and for some aspects of society, when that happens, people who work at schools are going to get COVID-19, and that is an issue.
I completely agree. I think that we have an opportunity to highlight a couple of resources and a couple of action items as well. So I have been following the Hawaii State Teachers Association, and they're very active on Facebook. They put a call out because policy recommendations have allowed for just, again, following AAP guidelines, just 3 feet apart between student desks. And it's so funny that the caveat is like the risk is is that much more reduced if students are just facing forward the whole time. I just think that we're hearing from a lot of teachers and educators about the the disconnect from reality, that young people are just going to sit face forward, and not move or do anything the entire time within a classroom. So they're actually calling for support, some testimony, um, and we can link to their website as well. I think it's key for us to highlight this because other states and counties might be following suit soon. And if you're a teacher and you're not feeling particularly safe within these parameters, like we do want to kind of show our support and speak out and speak up with our educators. So that's one I want to highlight. Um, Justin, I think also you were speaking to like the assessing risk, and I know AHWG has a blog. Do you want to speak about that?
Yeah, I referenced before that everyone has to make risk assessment decisions, and the blog post looks at the need to reset relationships by talking about kind of practices to stay safe and healthy. There are some similarities to having a talk with someone about sexual health, and it can be uncomfortable, and you have to build trust with the people that you're going to be interacting with. But it's a blog post that may be interesting, and we will link to it in the show notes. Adam, you have a discussion coming up regarding distance learning. Is that correct?
I do. So HWG has been working with a lot of different stakeholders the past couple of months around distance learning, trying to stay up to speed with what's going on with local community and school district planning. So we want to continue those conversations with key stakeholders being educators, schools, teachers, unions, obviously, parents and caregivers themselves, and then young people, middle school ranging all the way to college. So we have our next conversation happening on Thursday, July 23rd at 2 p.m. Pacific Standard Time. And so we invite folks from all across the country who are invested in this work. It will take place on Zoom, and it'll be really a community planning discussion. We are very much focused on creating resources and getting them out there. So if you're interested in working with us around primarily mental health support, just what does that look like given distance learning and homeschooling, and how we can create these bridges between the different audiences, I very much invite you to join us on the 23rd.
That sounds great. Thank you for sharing that. And then also for those who are watching or listening to this discussion, please know that we also kind of welcome any resources that you have seen that have been particularly valuable around distance learning. So whether you're a young person, a parent caregiver, or an educator, if there's something that you've seen that has been impactful for you, for your planning, and just in terms of thinking about the subject, let us know. You can send us a note at info@ahwg.org. And while you're at it, you can visit our website, which is ahwg.org. You can follow us on Facebook, follow us on Twitter, and follow us on Instagram, and subscribe to our email newsletter to keep up to date with both distance learning and all of the subjects that we discussed related to adolescent health. So that concludes this discussion. Thank you so much for joining us today, and we wish you all good health and to take care.